Hello everyone, my name is Shelley Beatty and I'm the Hair Restoration Director here at HRI of DFW. Today we're going to discuss the use of the products that you're going to be utilizing during your laser hair therapy protocol. It's important to understand that some of these products you will use every day and some you will only use on the days that you're going to be using a laser therapy treatment. We have 3 types of laser therapy here at Hair Restoration Institute. We have the use of the MEP90 laser therapy device that we utilize in clinic, and then we recommend using the iGrow laser therapy device for home use and the HRI Hair Therapy Dome as well. You will have been recommended one or the other, so please follow along on your instruction sheet and let's get started. The first product we're going to discuss is the scalp therapy. So on the days you're going to be utilizing a laser therapy treatment, whether you're doing one in clinic with the MEP90 or at home with either the iGrow or the HRI Therapy Dome, you're going to prepare your scalp first for a laser treatment by utilizing the scalp therapy. You're going to take your scalp therapy and utilize 1/4 of a cotton square. I've actually taken several cotton squares and cut them into fourths to create an entire bag. And it's really a great idea to go ahead and do that, because if you don't prepare the squares in advance, you might be tempted to use an entire square, and that is not going to be in your best interest. So please cut your little cotton squares into 1/4 pieces, take your scalp therapy and saturate that cotton square. It should be almost dripping wet. You're going to take the scalp therapy and make a center part in your hair. And then you're going to press that saturated cotton square onto the part. And then you're going to come over 1/4 of an inch to 1/2 of an inch, separate the hair again, and press that saturated cotton square onto the scalp. You're going to continue on by doing 1/4 to 1/2 inch partings and resaturating the scalp with your cotton square. As you're putting this cotton square onto the scalp, it should be very wet. If at any point your scalp is not getting wet from the scalp therapy, you need to resaturate the cotton square until it's almost dripping again. And don't worry, if it drips, it's not going to hurt anything. So just continue on with your 1/4 to 1/2 inch partings all the way across the area that you want to see improvement. So I've already done the center and down these sides. So now I'm going to come back and 1/4 to 1/2 of an inch over from that center part. Now I'm going to do the other side, saturating each parting. And so I'm going to do that in the entire area that I want to see improvement. And once you get all of it administered, you're going to allow the scalp therapy to sit for a full 5 minutes. Once the scalp therapy is finished, then we're going to shampoo the hair utilizing the DHT blocking shampoo. So now we have prepared the scalp with our scalp therapy. We've allowed it to sit for a full 5 minutes. The scalp therapy is going to go in and pull all the impurities out of the hair follicle that may be clogged. And then it's going to pull it all to the top so that when we shampoo with our DHT blocking shampoo, it can totally eliminate all of that blockage. So you're going to get in the shower, rinse your hair well, and then you're going to take your DHT blocking shampoo and squirt out about the size of a nickel. It's not very much, and you don't need very much. So squirt out the size of a nickel, emulsify the product in your hand first, and then go to the hair that's been saturated with water in the shower and work in circular motions to distribute the shampoo. Now when you first start using this shampoo, it's not going to lather a whole lot. It's really not supposed to. Those lathering agents that you are so familiar with and that most clients love are actually really bad on hair follicles that are degenerating and trying to die. So you're going to get a lot less lather from the DHT blocking shampoo, but that doesn't mean it's not getting your hair clean. It is getting your hair clean. So you're going to lather the shampoo on there and allow it to sit while you continue on and finish your shower. And then, once you're ready to rinse, you're going to rinse it off with as cool of water as you can stand. Cool water is the absolute best thing you can use on your hair. Rinse the shampoo with cool water, and then you're going to get ready to use the conditioning treatment. Okay, so now we've rinsed off the shampoo, and now we're ready to utilize the Vitamin Plus conditioning treatment. This conditioning treatment is not a deep conditioner. So for those ladies who have severely damaged hair, it's going to take a separate step. You're going to need a different product, and we would have discussed that during your consultation. So for everyone who's utilizing laser hair therapy, you're going to utilize the Vitamin Plus conditioning treatment. So after you've rinsed the shampoo with as cool of water as you can stand, you're going to take the conditioning treatment and squeeze out the size of a nickel into your hand, emulsify it in your hand, and then apply it onto the hair from the mid shaft to the ends. It doesn't really do you a lot of benefit to get this on the scalp, but it isn't going to hurt your scalp. But again, I wouldn't necessarily waste the product. I would put it on mid shaft to the ends, all over the hair. Allow it to sit up to 2 minutes, and then again, rinse it with as cool of water as you can stand. Now the next product we're going to discuss is the HRI Hair Therapy Complete. So now we're going to discuss the use of your complete hair therapy. This is the DHT blocker that you're going to utilize to protect your androgen receptor hair cells. There are two different versions. There's the complete, which is patented to protect the androgen receptor hair cells. And then there is the AA. The AA version is one that we recommend for clients who are allergic to shellfish. It has marine concentrate in it. So if you are allergic to shellfish, you need to utilize the AA version of the complete. So you simply take one in the morning and one in the evening for 90 days, and this bottle will last you an entire 90 days. It's very important that you take one in the morning and one in the evening. Don't take them both at the same time. It will not work to your benefit. So while you're trying to get new hair to grow, and while you're trying to get hair loss to stop, it is very important that you utilize the complete morning and evening. So now you have prepared your scalp for a laser treatment by utilizing the scalp therapy, the DHT blocking shampoo, and the Vitamin Plus conditioning treatment. Now, sometime during the day, you are going to utilize laser hair therapy. For those of you who are doing the strongest laser therapy available, you're going to utilize our in-clinic, FDA-cleared MEP90. For those of you who, for whatever reason, have chosen to use an at-home use laser therapy device, we also offer the FDA-cleared iGrow and the FDA-cleared Hair Therapy Dome. So let's discuss the use of each. So every day clients ask me, what's the difference in all the different types of lasers? So I'm going to do my best to explain. The MEP90 has 82 medical lasers in it. It requires a physician's oversight to be able to operate this device. And it requires a physician's prescription. He is responsible for your outcome. It was proven and tested by the FDA to regrow hair 100% of the time by all the participants who used it within the FDA study. It's really easy for us to guarantee results with the MEP90 because we have that FDA testing and backing behind it. Then there have been other devices that have come along after the MEP paved the way. Then we have the iGrow. The iGrow has 21 lasers in it. Again, compare that to the MEP90, which has 82. MEP90 does the entire head with laser therapy. The iGrow is going to localize the laser therapy to the top of the scalp. It's still a very good device, but obviously it's 1/4 as strong as the MEP90 with only 21 lasers. But the iGrow is very convenient to use from home. So the best way to use it is to take the handheld device here, place the iGrow on your scalp, and you're going to turn the device on. And you will have been recommended a particular button to push based on your hair loss. So then you're going to select your program and turn it on. Now this particular program is a 20-minute program, and as you can see, the lasers have now begun. It's very important that when you're doing a laser therapy treatment that you not over laser. And if you'll follow your instructions carefully, it says do not use laser on consecutive days and do not overuse. So if you've been recommended to this 20-minute treatment, do not use more than that and do not use it on consecutive days. Best advice is to use it 3 days a week, preferably Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. Get into a routine, because the best results from laser therapy will come to those who utilize it with the most consistency. It's not necessarily the amount of time that is going to give you the most benefit. The consistency is the best benefit. So you're going to allow it to run its full course. If at some point you have to pause it, let's say you have to answer the door or for some reason you get interrupted, pause the device, take it off, set it down, and then when you're able to return, put the device back on your scalp and press the resume button. Do not start an entirely new laser treatment. Again, you'll be risking the opportunity to over laser. If you ever have any questions about your iGrow, please don't hesitate to send us an email, and remember, it's on the very bottom of your instruction sheet. So now let's talk about the HRI Therapy Dome. So now we've prepared our scalp for a laser treatment using the Scalp Therapy, the DHT blocking shampoo, and the Vitamin Plus conditioning treatment. Now it's time to do our home use laser therapy treatment session. This particular time we're going to be discussing the use of the TheraDome. The TheraDome has 80 lasers in it. So just to compare, the MEP90 has 82 medical lasers in it that require physician oversight to be able to utilize. Also requires a physician's prescription. The TheraDome has 80 lasers in it. They're not medical lasers, and there is controversy depending on who you speak to about the difference in the laser light therapy that one would receive from the TheraDome versus the MEP90. The TheraDome has FDA clearance strictly based on the fact that their platform operates very similarly to the MEP90. The TheraDome has never had an FDA test performed to verify its efficacy. The MEP90 has. But based on the fact that the TheraDome operates similarly to the MEP, the FDA gave it clearance to utilize as a laser therapy treatment. So again, just to reiterate, if you're looking for the strongest laser therapy available, the best way to ensure that you're getting that is to use the MEP90. But if you can't, for reasons such as convenience, or maybe you live too far away, the TheraDome is a great option. So you basically just put it on your scalp that you've already prepared for a scalp treatment, laser therapy treatment. Make sure that you're placing it on a clean, dry scalp. Put it into place, and you literally press a button to turn it on. We just recently added the new Laser Cap laser hair therapy device. 224 lasers designed to focus on the top area of the scalp only. This new device has, again, 224 lasers in it. It comes with 2 hats that you can use to completely disguise the fact that you're even doing a laser therapy treatment. It comes with this great battery pack. You could wear it on your way to work, on the way home from work. You could certainly wear it anywhere in the house. And all you do is push a button and the lights come on, giving you direct and intense laser hair therapy best suited for clients such as this on the screen. This laser cap device does not have FDA clearance. It does meet all FDA standards for utilizing a laser, but it has not been cleared as a medical treatment for hair loss. But make no mistake, that doesn't mean it's not effective. As a matter of fact, the only place you can get a laser cap is through a physician. I'm sure the FDA clearance will be coming soon. But again, the best people for this device are women or men whose hair loss is localized to the top of the head because it covers very little of the crown. But because all 224 lasers are in this one small area, you can get excellent results in a fairly short amount of time. And now we're going to discuss the use of the night treatment. We have two different night treatments. You will not have been recommended to use them both. You will either have been recommended to use Minoxidil or MGT. Let's start with the MGT. At night, before you go to bed, you're going to take your MGT, open up your bottle, and get all the product down to the end of the bottle and squeeze out one drop and allow it to fall naturally. Do not squeeze it and then wipe it off. You want to let one full drop come out, and that's about the size that it will be. So it's a pretty good amount. So you're going to take this MGT, you're going to part your hair down the center, and you're going to get up some product on the fingertip and then wipe off the excess, and then press this product down on the scalp and then give it one wipe to just distribute it onto the parting. Then you're going to come a ½ inch over, similar to what you did with your scalp therapy. Get product on the tip of your finger, wipe off the excess, and apply it to the part and give it one wipe to distribute it. We're going to continue this process in ½ inch partings all the way across the area that you want to see improvement. It's very important that you really try to localize the use of this product onto the scalp and not the hair. Listen, it's almost impossible to not get any of this on the hair, but the idea really is to localize it onto the scalp. So I'm going to place this in ½ inch partings all the way across in the area that I want to see improvement. You want to see improvement all the way to the sides, place it all the way down to the sides. Just make sure that you distribute it across that part line. So we've already done the center part, don't need to do that again. I'm going to come a ½ inch over, separate the hair, and it's not going to be perfect, and that's okay. You'll get better at it as you move along. On the part line, distribute it. And believe it or not, it's actually easier to do this on yourself than it is this silly mannequin. ½ inch partings, blot it, and then distribute it. So once you get that in all the areas that you want to improve, you're going to allow that to sit on your scalp all night long. MGT is a vasodilator, which means it is going to force all those blood vessels that are sitting just beneath the surface of the skin to go into overdrive all night long. So it's like another form of stimulation that is going to work to help your hair grow. So again, place it on, allow it to sit all night. So the next morning, after you've used MGT at night, we're going to brush the hair very well from roots to ends by utilizing a brush where the bristles are very close together. My favorite type is this brush from a company called Hair Dreams. The bristles are very close together, and this brush alone is an additional form of scalp stimulation. But you'll notice you've got these bristles that are higher and the bristles that are lower, and they're very close together. This is the type of brush you want to use. And just as an example, you would not want to use a brush that looks similar to this, where the bristles are very far apart. So you're going to take a brush where the bristles are very close together, and you're going to brush the hair from roots to ends. So if you'll notice, if this is the scalp, I am laying the brush on there and I'm basically pulling on the hair. This is going to distribute that product all the way onto the hair and off of the scalp. Now in the morning, if after you brush your hair very well from roots to ends all the way around, your hair really should have lots of body and volume to it, similar to this. If after you brush your hair, if your hair is flat or oily, use that as a signal that you used too much of that MGT at night, or you got too much on the hair and not enough on the scalp. So try again the next night to really localize the use of the MGT to just be on the scalp. So that's your signal. When you brush your hair the next morning, it should have a lot of volume in it. Now the next night treatment we're going to discuss is the use of the Minoxidil. So now we're going to discuss the use of the Minoxidil. People ask me all the time, what's the difference in this Minoxidil versus the Minoxidil that I can buy at the grocery store? The biggest difference is this. This Minoxidil is pure 5% Minoxidil. It's not combined with buffers such as Rogaine. And the most important part is you'll see that it has 5% palmetto. If you look up saw palmetto anywhere on the internet, you will see that they recommend it for people who are trying to regrow hair. And saw palmetto is going to force this Minoxidil to go down deeper into the hair follicle, therefore delivering the Minoxidil and more of it to the root of the hair. So the best way to utilize this Minoxidil is to squeeze up, just open up the lid and squeeze this little bottle, this little top, and it's going to draw up 1 ml of your product. And again, you're going to follow along with your instructions. Most of the time we recommend that people use it only at night. Some people we're going to recommend that you use it in the morning and at night, but please don't do that if you've not been recommended to do so. So you've drawn up your 1 ml of product. You've got your center part. We're going to drop, and I'm really not even having to barely squeeze on this little dropper, and it's coming out 1 drop at a time, and I'm just going to distribute that Minoxidil onto that part line. And then I'm going to come 1/2 inch over. We're seeing a pattern here. This is the same thing that we did with the scalp therapy. This is the same thing that we did with the MGT. 1/2 inch partings, and we're dropping the product on, and we are distributing it. Again, come 1/2 inch over, and again, it's really a lot easier to do on yourself than it is on this mannequin. Drop it on and distribute. Come 1/2 inch over, drop it on and distribute. And again, you're going to do that everywhere you want to see improvement. And you're going to end up using the entire 1 ml of the product. And then you're going to allow that to sit on your scalp all night long. So now we're just going to do a quick recap. We've discussed the different types of laser therapy that we offer here at HRI DFW. We've discussed the use of the MEP90, the use of the iGrow, and the use of the Theradome. We've also discussed the use of the scalp therapy, the DHT blocking shampoo, the Vitamin Plus conditioning treatment, the MGT, the Minoxidil, and the HRI Hair Therapy Complete. So just remember, on the days you're going to utilize a laser treatment, you're going to prepare your scalp with the scalp therapy, the shampoo, and the conditioner. Sometime during the day, you're going to utilize your laser therapy on a clean, dry scalp. And in the morning and in the evening, you're going to take your hair therapy complete. And at night, you're either going to use MGT or Minoxidil. If at any time you have any questions or concerns, please refer back to your instruction sheet that you were given when you began or at your last checkup. You will notice that all of your instructions are written here. The items that you are going to be using are going to be checked off on the left. And you're going to see down here on the bottom your instructions for utilizing laser therapy and when you should schedule your next checkup. We are not going to automatically schedule your checkups for you. That is your responsibility. But we will at least let you know when you should schedule your next checkup. So just a couple of reminders. You're never going to do any type of laser treatment on consecutive days. That will not work to your benefit. Follow the instructions on your sheet. You're never going to do hair color and a laser treatment on the same day. That's too much scalp stimulation. And again, all of this is written on your sheet. So please feel free to contact us at any time with any questions or concerns you have, and we cannot wait to see you with more hair.